Hello, hello, hello once again. Welcome to day 12. Here we are. We are going live on every channel that we possibly can. So today I want to welcome you to our live, and we are going to be talking about cancer today. So today is I'm going to talk to you about some of the things that you need to know and that would help you if you know of someone who have experienced cancer. You can pass this message on to them as well. I think it's important to share. Welcome, 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 everyone here. So again, welcome to the Unstoppable Life Show with Verna Haywood. And today I'll be talking about breast cancer screening. So today we are diving deep into this critical information because it's information that we need to the screening that could potentially save lives. Okay, could save lives. So here I am Verna, and I am thrilled to be your host for this meaningful conversation or discussion. Feel free to write your comments in the comments so I can see them and I can share with you. If you have any questions, also feel free to write in the comments, and let's have a meaningful discussion. I created this challenge so that I can create a community where we can be together, where we can share things together, where we can be a support for one another, because I understand the importance of having support and having the right support around you to really help to strengthen you and for you to grow. So that's the key reasons why I've done it. The other reason as well is because I'm here to serve. And I want to be able to give back for all the years that and all the things that I have been through and I have learned through my experiences so that I can help others to overcome their own difficulties, their own challenges. I don't like to say obstacles, and yes, they are difficult times, but they are challenging times. So depends on the word. So words are very important, and I try to use words that would really uplift and really take us on the path to recovery. So why breast screening? Why do we want to talk about cancer? Because it is something that affects a lot of people. Some people, there are many different types of cancers, but I am talking about breast cancer. It is very prevalent, and we can see it happening all over the world. And it doesn't matter who you are, cancer does not choose who to attack. It doesn't matter whether you're rich or whether you're poor, whether you're insignificant or you're significant. It doesn't really matter. It will come on anyone. And this is something that we have got to understand and just take note of. Is now we tend to say, why me? Why not? Because there is a lesson in everything. And in that lesson, we can help others. So I just want to uh, ask you to embrace everything that we are going to discuss today. So, why breast cancer screening matters? It matters a whole lot. Okay. So if we look at the basics, breast cancer is the most common cancer. Yeah. So whereas you have all other cancers, breast cancer is the most common cancer, and it affects women worldwide. As I said before, it doesn't matter what country, rich or poor, big or small, bright or no bright, it doesn't really matter. It affects women all over the world. So early detection is very, very crucial for saving one's life. And early detection is either through breast screening or by examining your breasts. I examined my breasts, but I didn't feel anything. I just saw my breasts was getting bigger, and I paid no attention to it. I didn't go to the doctor. I didn't seek any help or anything like that. I just thought it's enlarging. That happens. And little did I know, but my body was telling me something is wrong. But I ignored the signal and just carried on as normal. And then I had a letter. You would have heard me say that in some of my talks before, but it's worth repeating again because faith come by hearing and by hearing and by hearing the word. So when we hear the word, we then start believing it, it start feeding into our subconscious, and it start changing our mentality towards whatever it is. So my mentality has changed in terms of looking at when my body speaks to me, what do I do? So why it is breast screening is so important. Early detection is so important. Early detection, I mean, it could have been earlier, as in 2018, and I would not have had to go through chemotherapy and surgery and all of that. But because I did not listen when it was detected, I had to go through all of that. Otherwise, it would have been most chaotic for me. Okay, so that's why it is important for you to have an early breast screening detection. That is why it's important for you to examine your breast. So the survival rate is much higher when we get an early detection. An early detection, it is understood when you get screened how important that is. So when I got screened, um, I don't like to say my cancer, the cancer within my body was already 17 millimeters. So it was fast growing. Okay. Had there again, I would repeat, if I had done it in 2018, there would have been just the beginning of it, and I would not have had to go through all the things that I went through. But I had to go through it so that I can talk about it. I can bring it to your awareness. So, what I'm doing is raising awareness. I can bring it to your awareness so that you understand the importance of why you should have breast screening and why you should have it early, and do your examination as well. So, there are the different types of breast cancer. There are different types um, of breast cancer screening. So you have your mammogram, which we talk about, so which is an X-ray image of the breast, and that's what they did. They did an X-ray image of the breast, and it is recommended that you have it annually, and I think it starts from age of 40. Maybe it should start earlier. I don't know. And I mentioned about having your breast examined, so maybe having a clinical examination. So even if you do it, it is wise to get a clinical examination. So that is a physical one by a healthcare provider, a healthcare professional who knows what they are looking for and can examine the breast in a way that will give you the um, the knowledge and the understanding. So again, it is recommended for women in their 20s and 30s, and annually for women to have it from age 40 and over to have it annually. So providers recommend that 1 to 3 years that you should try and have your breasts physically examined. I didn't do that either. So I'm just using a human experience to bring that across to you and let you know what it is that you can do to save your life or a friend life or a family's life. So don't hold on and don't wait. Who should have? You're probably asking yourself, who should get screened? Well, according to the guidelines, which is varied, is based on age and risk factors. So risk factors could be maybe it's in your family, it's happening in your family, or maybe um, I think like things like the other obesity and stress and all these different things can bring on all of that as well. We don't realize that stress is the number one killer. 98% of the world's population suffer with stress. And one of the things we can do to combat that is to take an adaptogen, so which really help to suppress that, but also using meditation as well, to really help you to change your mindset and allow whatever is happening to just fall off like a duck's back. I know it's not as easy as that, but it's something we practice. And this is where our resilience come in because we practice these things to really help us to overcome these situations. So, as I said, generally women should start having a regular screening at age 40 or earlier. And if they have any family history, any risk factors, then they should really think about that. So, if in your family there's a history of cancer, then I would suggest you try getting screening as early as possible. There are lots of myths out there. So let's try to dispel some of the myths that are out there about screening. And I had that myth. Okay. I had that. I was like, I'm not getting any screening because I had it before and it was so painful. No, turn here, turn there, lift your breast up, put it underneath this thing, and clamp it down like, oh my word, it's hurt, it's painful. So I decided I was not going to have any more um, um, tests. It's the same thing when you go for a pap smear. It's so painful. And you're thinking, I'm never having this again. But how else would you know what's going on in your body? So having those medical checkups and having those different types of screening, what it actually doing is saving your life and may save it other people's life. So you can be a testament for others as to why they should have it. And that's what I am doing. I'm being a testament to you to tell you why you should have it. So screening. Once some of the myths are, I don't need a screening if I have no symptoms. You don't have to have a symptom. I didn't have a symptom. I just felt my boobs was getting enlarged. So I'm becoming voluptuous. So you understand? We make a fun of that because nice cleavage and everything like that. This is growing naturally. There is no enhancement. Yeah, there's an enhancement going on that you don't know about. So if you had some screening, you would know that this is not natural. So you don't have to have a symptom to know that you should have a screening. Or you might do like me and said, oh, this mammogram is too painful. And I did. As I said before, I thought this is too painful. I am never having it again. All right. And if I did not follow my intuition, it would have been much worse. Okay. So it would have penetrated, go through the duct, go through everything else, and get into my bloodstream. And then what? It travels over my body. And who knows what thereafter. Okay. So it's important to listen to your body. But most importantly, don't just listen to your body. Do the normal medical checkups every year. And if you notice something out of sort, like I did, then take time and visit your GP or your medical practitioner or whoever and get checked. It's very, very important. So let's dispel those myths that I don't need to have it because I don't have a symptom. I don't need to have it because it's too painful. I don't need to get checked for whatever reason. So early detections save lives. Okay? Early detection save life. Yes, it is uncomfortable. Yes, it is a discomfort, but it's only for a short period. We tend to forget that. I forgot it was just a short period and I'm not there forever with this clamp on my boobs. Okay? It's only for a short period and it will save your life as it did mine. It saved my life. Okay? Because I would have just carried on without doing it. So here again. So those are myths that you can dispel. What are the resources? What resources are out there for you to know about? So if you have a friend or anybody who have not had their mammogram, I want to encourage you to have a mammogram. If you have not had a clinical test, I want to encourage you to book an appointment and have a clinical test. If you have seen anything abnormal, go have a test, ask a question. There is no question too silly or too stupid because we tend to think, oh, I did that. I don't want to ask a question because I'll be disturbing someone. No, that's why they are clinicians. That's why they are doing their job. We all have a gift, and every gift come with a purpose, and that purpose is to serve. So if we don't If we don't ask the question, we don't give them the opportunity to serve, how can they serve us best? They can't, because we are not opening our mouths and we are not speaking. Just remember, world over, women, breast cancer is the most growing cancer. Okay, all right. And just to say, at the moment, breast cancer now for October, we'll be having a pink. So wearing pink. So I will encourage you to get into your pink gear for October, so we can support breast cancer now, because there are women living with secondary cancer, and we are trying to raise funds so the government can have um, this new drug that can help these women to live a better life and to be there with their families. And we're looking for a cure. So at some point, I will have a GoFundMe page. I'm trying to do what I can so I too can help other women to survive this disease and for us to find a cure that will get rid of it completely. But in the meantime, we need to do our bit. So what resources are out there? As I said, you have organizations like Cancer Research UK. You have, for those of you in America, you have the USA American Cancer Society. For those of you in Australia and other parts of the world, you have your organizations there. So, what I would suggest is that you do some research and find those organizations, listen to friends, and listen to this message and take the necessary precaution so you can save your life and you can save the lives of other women. Um, these society, they provide valuable information, valuable resources to support and to help you understand breast cancer screening and its guidelines. They can offer guidance that are tailor made to suit you, because not everybody's cancer is the same. Not everybody go through the same procedure. Yes, we will have some people will have to take chemotherapy and radiotherapy and have surgery, but sometimes it's like, okay, they may have to shrink it first before they could do surgery, or there are lots of different things that happen. So one of the things that I found out when I was having my treatment is that when I looked at everybody's treatment, it was all totally different. Whatever cancer drug they were given was totally different to mine. So that told me that everyone was different. And in speaking to one of the ladies, I found out that they was reducing hers first before she had surgery, whereas I had surgery and then had all the other treatments I needed to have. Okay, so everyone is different. So don't think that everyone get the same. No, it's not the same, and everyone get different. Um, if you have any questions, I would suggest that you put your questions in the comment box when you listen to this podcast, or you listen to this live presentation at your leisure. When you listen to it, I would encourage you to leave your questions. Any questions about screening? What did I go through? If it's treatments, information around guidelines or information around the myths or other related topics, feel free, because I use diet as well. I know some people uh, would not have the chemotherapy and the radiotherapy because of the drugs. They don't want it in the system. Everybody is different. Okay. So everybody have to make their own choice and their own call for themselves. And so I would say listen to what others have to say, but make your decision for yourself. You are answerable to you. No one is answerable for you. You are answerable for you. So I listened to everything and I heard everything and I heard everyone. And then the bombardment was a little too much for me. So I zoned out and just went inwards and started meditating and praying, and had my circle of friends around me who was helping me, and family friends who were doctors, and my nephews who really spoke into me. And I made my decision. This is the way I was going to do, and I was going to do it, top it up with food. scientifically, go to the science of the food, go down deep and find out what it is I can use that can cure this cancer, that can kill these cancer cells. Okay, so there are lots of things out there that you can do. The other part as well that I just want to say, there is just so much I can talk about this, but maybe that's for another day. And we can have a webinar or something like that. And then we can go deep into it where I can have other women who have experienced cancer and who have experienced domestic abuse and sexual violence. So we can talk about it on a broader scope, and we can look at how diet play an important part in our mindset, in the way our body heal and everything like that. So this is what I am doing, and I am encouraging you to do the same. The other thing I want to let you know about is that I have a website called Verna Haywood.com. You can go out there and you can check out the things that I do. I do coaching on a one-to-one, so you can do no, not everybody is a fit for me, so you can book a consultation. It's completely free, no pushy sales, no nothing. It's entirely up to you. But you can come and have a conversation with me, and we can talk about whatever it is on your mind, so that we can really get to the root of the problem. You may not be for me, but you might be for someone else, and I can recommend you who to go to and get the help that you need. So, in closing, what do I want to say in closing? In closing, I want to say thank you. Thank you, thank you, thank you. Thank you for being here. Thank you for popping in and out. And some of you on your lunch, or some of you might be at your desk, okay, working. But please take time for breaks. It's important. Okay, so thank you for listening to me. And remember, knowledge is power. Knowledge helps us when we understand, when we have a knowledge of what breast cancer is and the devastating effects it can have on a family, not just you as a person, but on a family, because it doesn't just affect you, it affects the whole family. Everybody in the family is affected by breast cancer. So take the time to understand what breast screening is all about. You could listen to this video again. And again, as I said, if you have any questions, feel free to send me your questions and I will answer them. Take regular health checks. When you get regular health checks, make sure you have a clinician who is going to examine your breasts for you. Okay. If you see anything or you feel anything, if your body is speaking to you and you feel anything that a detection of cancer, you don't know it's cancer, but you feel anything strange, have check. Go have a check. Go have a mammogram. Get a check, and then they will let you know when you need to have a mammogram, or if you just need to have your clinical checks as normal. Okay. Even though I have had my surgery and I've gone through all the different treatments that I need to go through, I maintain my healthy, balanced diet by eating the types of foods. I will go through some of that with you later today. I'm not going to be in my kitchen, which I would love to be in the kitchen to really have the video there, but I don't have the equipment to do that as yet, where I can be filming in my kitchen and showing you all the ingredients. But I will try and come up with something that I can show you later today of what I do. So I am doing all of that. And yes, I still have to carry on taking some treatments, which I take. I still have some chemo, which is every 6 months, but I do have medication that I take on a daily basis. And I have my food to really supplement that. So my body get a detox that it needs, but the medication gets its process to work. And also the food that I eat has doing its own job as well, because I'm eating food that can combat cancer. Okay, so make sure and talk to your health provider. Make sure and get your screening. Make sure and if you notice anything, that you speak to somebody who can give you the proper guidance. And I want to encourage everyone to do the same. to encourage your family member, all the people in your sphere. Encourage them to do the same. Encourage them to get screening. I know we're talking about breast cancer, but something is telling me we need to talk about cervical cancer as well. So if you haven't had your screening for your cervix, I would suggest that you do that. I get both. Okay. I get both. I even had for my bowel as well. So, check everything, every area. Don't wait. Don't wait for it to appear and then go check. So do check yourself and get somebody to check everything for you. And it would make a big difference. It would make a big difference to our world. It would make a big difference for women. It would make a big difference. Men do get breast cancer as well, but it would make a big difference and it would save lives. So I just want to encourage you again and again and again. Seek help, get the assistance you need, and stay blessed. Stay strong. Change your mindset because your mindset have everything to do with your health, with your healing. We can heal from the inside, but we have got to change our mind. Okay? So stay focused, stay blessed, and see you in my next live. God bless.